Hello, I'm Madeline Black from Studio M, and I'm here to give you a few tips on how to stand in a more balanced way to support your spine and have your postural muscles, especially your core muscles, engaged to support yourself while you're standing. This is my friend Hannah, and if you notice how she's standing, it's very typical of many people these days, especially young women, where they tend to stand swayed out into the hip here. And what that does to the body is it starts to side bend the spine, almost like a scoliosis, creating compression on one side of the back, compression on one side of the neck, and also the hip joints are out of alignment. So all of that can cause a lot of discomfort and in some cases pain. So if we line ourselves up over our base, which is our feet, then the rest of the body has a better chance of stacking up and being more relaxed and supported by your skeleton. So let's start at the base. So let's look down at the feet. So what we want to feel is that you can have your weight distributed between the big toe ball and the outside of your heel, specifically right here. So if I have Hannah roll to the outside of her heel, notice all her weight's on the little toe side of her foot, and the big toe is off the floor. I call that arches out. Let's do it on that foot too, or supination. And then come back. If I have too much weight on the big toe ball, the arches collapse in. It's also called pronation. I call it arches in. But we want to find a balance between the two places. So if you think of keeping contact with the big toe ball and keeping the weight under the ankle bone here, you create a nice dome for the foot for support. And then from there, where's your weight on your feet? So she's got a good dome now with some contact at the big toe ball and the outer heel by the ankle. But where's the weight? Is it too far back or too far forward on the feet? We kind of want to find the center point between these points of the back of the heel here and the big toe. And that will help align the pelvis up. If my weight's back on my heels, I tend to push my knees back and arch the back, which is not a great position for the spine, nor for your abdominal muscle control here. So if my weight shifts over the feet, you'll notice that the pelvis starts to shift and then you have more core contraction. The next place that we want to stack on top of the pelvis is the diaphragm. So her diaphragm or lower rib cage here should be right over the pelvis. And we tend to do is let the diaphragm come up this way a little bit. So we want to feel that that diaphragm is sitting right over us, which means your abdominals are going to kick in naturally. They're just going to engage. And then from here, we want to find that the ears and the head are floating also stacked on top of that position. And then there's an axial elongation that happens. So if I ask Hannah to imagine a string at the top of her head, the crown of her head going straight up, it creates an integrity in the spine to be supportive and relaxed. And this will enable you to keep good postural muscles strong and better breathing and less pain and discomfort. So please be aware of how you stand throughout your day. It makes a big difference. Thank you.